My name is Steve Broder. I am an anesthesiologist here at the Synergy Center. I'd like to go over some of the issues with anesthesia, as well as what your experience is likely to be when you come here for your surgery. What we do first is we talk to you in great detail about your medical history, and then we plan an anesthetic which is appropriate for you and the type of surgery you're having.
After checking in, you will be assigned to a bed in the preoperative area. The nurses will begin preparations by attaching a series of monitors that will measure your heart rate, blood oxygenation, and your pulse. An IV will be started,
and a blood pressure cuff will be attached.
A series of medications will be given to you through your IV. This includes an antibiotic to lower the risk of infection and other medications to help with pain and nausea.
After we obtain that information, we take you to an operating room. We put on various monitors that look at your blood pressure, your heart rate, your breathing rate, and how much oxygen is in your bloodstream. We will always be there with you the entire operation. The anesthetic will go as follows. The first thing we will do is give you medication in your intravenous that will render you unconscious in a sleep-like state. You will feel no pain, you will be asleep the entire operation, and you will wake up at the end of the operation. While you are asleep, we will be giving you anesthesia gases, and that is administered either through a mask-like device or with a breathing tube, depending on what operation you're having and what your medical problems are. At the conclusion of the surgery, you will wake up, you will go to a recovery room, and you will be taken care of there by recovery room nurses. When you wake up from your anesthetic, you will probably be a little sleepy, you may be a little disoriented. It's also possible you may have a dry mouth, but you will be very safe and you will be very comfortable. You can expect to wake up slowly over the next 10 minutes and be back to yourself within the hour. There are some risks with anesthesia. It is a very safe procedure, but there are some risks. Some of those risks include nausea or vomiting. There's a risk of a sore throat. There's a risk of an allergic reaction to some of the medications we use. Those are very low risks though. Even rarer risks include dental damage or damage to the mouth or gums. There is also an extremely rare chance of having an unusual or unplanned allergic reaction to some of the medications. There is a very low risk of having an airway infection or airway problem. The overall risk of anything serious from anesthesia is less than the chances of winning the lottery. We're talking about 1 out of 500,000 or less. It is very important to not have anything to eat or drink after midnight the night before your surgery. It is also possible if you have a very early operation, we may ask you to not eat or drink after 10 o'clock.